Welcome. We're in the abnormal psychology looking at mood disorders, and we're going to begin this by looking at, what is a mood disorder? Well, mood disorders are disturbances in mood that are serious enough to impair functioning. There are various kinds of mood disorders, including depressive, unipolar. Unipolar just means just depression, and that can include major depression, persistent depressive disorder, and disorders involving mood swings. And those could include things like bipolar and cyclothymic disorder. And we'll look at these ones more carefully, a bit at a time. An additional note here is consider reading the yellow highlighted box for the examples of particular disorders and or the treatment approaches. You'll find them in your textbook. You may find them helpful in understanding some of the disorders in a little more detail and a little more specific. Even some of the breakout boxes that individual people have commented on, just in terms of, here's an example, you'll find those periodically. And also keep in mind that throughout the chapters from here on in, like from anxiety and mood disorders and moving on forward, there will be the DSM-5 breakdown of classification of how things are determined. You might find those helpful too. Alrighty, let's get started. Mood disorders are disturbances in mood that are serious enough to impair daily functioning. Now, keep in mind, daily functioning is being able to get up in the morning when you plan to, have breakfast, go to work, after work, go socialize with your friends, go to bed at an appropriate time, and get up and repeat. If mood disorders affect that daily functioning, then it's serious enough to be considered, at least initially, as a mood disorder. They can take various forms, including depressive unipolar disorders such as major depression or dysphoric disorder, and disorders involving mood swings such as bipolar disorder or cyclothymic disorder. Now, people with major depressive disorder experience profound changes in mood that impair their ability to function. Severe mood disorder characterized by the occurrence of major depressive episodes in the absence of a history of manic episodes. Manic episodes would suggest bipolar, so this does not involve any of the manics, but generally just focuses on having depressed episodes. And there are many associated features along with major depression. They include depressed mood, changes in appetite, difficulty sleeping, reduced sense of pleasure in formerly enjoyable activities, feelings of fatigue or loss of energy, a sense of worthlessness, excessive or misplaced guilt, difficulties in concentrating, thinking clearly or making decisions, repeated thoughts of death or suicide, attempts at suicide, or even psychotic behaviors like hallucinations and delusions. Now, although changes in mood in response to ups and downs of everyday life may be quite normal, persistent and severe changes in mood or cycles of extreme elation or depression may suggest the presence of a mood disorder. And this chart just sort of gives you a sense. There's a certain variability of what we would consider to be normal kinds of fluctuations in mood. But if they get extreme, now again, depression has some very significant, and there's some time considerations. This isn't something that happens over the course of a day. This is something that occurs over the course of weeks and months. Okay? So when we think in terms of, who's most likely? Well, in Canada, depressive disorders are most common in adolescence and in early adulthood. So that's the ages of 15 to 24. Through adolescence and adulthood, 15 to 64 years of age, women have the highest prevalence of depressive disorder compared to men. Older adults, 65 and older, have the lowest prevalence of depressive disorder, and no significant difference between men and women in that age group. About twice as many women as men seem to be affected by major depression, but the reasons for this gender difference remain unclear. Depression can begin or occur and reoccur at any age, but the risks of initial onset of depression is age-related and usually early in life. Major depression has been increasing worldwide. So if we think in terms of what are some of the risks, well, age, is a big one. Socioeconomic status can impact depression, and so can marital status. So we'll move into another, sometimes less known, but not less affecting of individuals. It's what's known as seasonal affective disorder. Some people report that moods are affected by seasonal weather, most notably winter and summer. They feel good in the summer, there's longer daylight, and moody in the winter, shorter daylight. Now, seasonal affective disorder affects women more than men, and it's most commonly among young adults. Possibly occurs in children, but not as commonly in young adults. Features of SAD, seasonal affective disorder: fatigue, excessive sleep, craving carbohydrates, and weight gain. Now, this next you've probably heard of before. The premenstrual dysphoric disorder is it is an addition to the new DSM-5. Now, you may not have known it by that term, and it is characterized by persistent and severe mood swings, mood changes that revolve around the woman's menstrual cycle. It's often been linked to hormones. Now, persistent depressive disorder is a form of chronic depression that is milder than major depression and seems to follow a chronic course of development that often begins in childhood or adolescence, but may nonetheless be associated with impaired functioning in social and occupational roles. Now, the disorder characterized by mood swings between states of extreme elation and severe depression is formerly known as manic depression, is what is now known as bipolar. And there are two types of bipolar disorders: bipolar 1 disorder and bipolar 2. Bipolar 1 disorder is identified by the occurrence of one or more manic episodes, which generally, but not necessarily, occur in persons who have experienced major depressive episodes. In bipolar 2, depressive episodes occur along with hypomanic episodes, but without the occurrence of a full-blown manic episode. Now, manic episodes are characterized by sudden elation or expansion of mood and a sense of self-importance, feelings of almost boundless energy, hyperactivity, and extreme social ability. Often takes a demanding and overbearing form. People in manic episodes tend to exhibit pressured or rapid speech, flight of ideas. You can't keep up with them. They keep changing the subject, but they keep moving through them, and they seem to have a decreased need of sleep. So if we think in terms of bipolar, when I mentioned, there's some when we talk about a manic episode, you could look at it in terms of there's the hypomania and mania. Major depression would fall in the middle, and so you're looking at bipolar 1 on the right in the yellow and bipolar 2 on the left. Pressured speech, this is the outpouring of speech in which words seem to surge urgently for expression as in a manic state. Now, pressured speech would just be like, I just got to get this out, and I just got to keep talking about it, and I just got it. And it's almost as if I don't get it out right now, the whole world's going to come to an end. At least my world will come to an end. Now, rapid flight of ideas was characteristic by manic behavior involving rapid speech and a change of topics. If you're talking with someone who's going through this, they can go through a rapid succession of topics, not completing thoughts or ideas. It would be quite noticeable, and it lasts longer than, say, you were just trying to, do this for a couple of minutes. This would be going on for hours, maybe even days. Some of the other experiences of manic episodes you'll find in your textbook. Now, what you're seeing here is a bit of a chart to help distinguish between what is bipolar 1, what is bipolar 2, and what is cyclothymic or cyclothymic disorder, which is a mood disorder characterized by chronic patterns of mild mood swings between depression and mania that are not sufficient severity to be classified as bipolar. Now, it sort of hems and haws out of what would be considered manageable, normal, highs and lows that you can still manage to get through your days. It might be something that, is aggravating you or, kind of nags at you, but it's not going to interfere with your ability getting out of bed, going to work, socializing with friends. This is beyond that, but it's not as severe as the mania or depression of bipolar 1 or bipolar 2. Hypomanic or hypo means less than. So therefore, hypomania is mania that is less than a bipolar. All right, so that's just basically going through the criteria, or at least what are the major mood disorders. And now what we'll do in part 2 is look at the perspectives of how do they each understand, or where did they think they came from, or how are they developed. All right, let's carry on, everybody. Keep up. You're doing great. Bye now.